Good morning and welcome to the free webinar lecture today on the Three Bodies Method. As usual, there's a lot of information and I'm so happy that you're all here today. I'd like to start in a couple of minutes, so just make yourself comfortable. We're going to start with a brief meditation, a guided visualization, what I'm calling now body poetry.
Yep. How do I get the video?
Go ahead and mute for me. Let's mute everybody.
Yeah.
Okay. Great. Excellent. Super. So just bear with me and we'll start in about 3 minutes. I'll be right back.
I think Carey muted me because I yelled for you.
Okay, well then mute yourself. Mute, then you know how to unmute, so mute yourself right there. Mobile number ending in 7955 has incurred international long-distance charges.
Yeah, so I don't know.
Did you send me the link yet, or?
I sent it to you.
I don't have it. Did you call or something with your phone? Are you muted?
Unmute, huh? I'm not muted.
Mute yourself.
Okay. Welcome, everyone. I invite you to get comfortable. Stretching all the way from Florence, Italy to you. Let's create a global circle. We've all been working really hard and supporting the world with our work that we're doing with people on our tables. The work that you're doing is world work, and self-regulating is key. So let's all create space together now. We're going to start with a video. You can turn off your video. You can lay down on the floor. You can listen to this at another time. You can go prepare something else, come back to, this is your free space. And after the brief containment of our bodies, sensorial experience of our bodies, this body poetry experience of experiencing the ocean of ourselves, We'll go into a lecture where I'm going to talk a little bit about what it means. What is this three bodies method? We're going to review the lymphatic supportive technique of the collarbone, and we're going to talk about how a lot of the work now has gone multidimensional, the biomechanical. Today we're here for the biomechanical, where it meets the biodynamic, because really they belong together. And to really study how we can be deep listeners in our work and to reach beyond the containment of the you and me and become one through unity in our work. So welcome. There is no volume for this video, so not to worry if you don't hear anything, because I would really like for you to hear my voice, if it feels comfortable, and follow my voice and follow the expression of what your brain knows through the experience versus music or any back talk. Is just to sink into, maybe even taking a picture with your eyes every so often. You might even just open your eyes 40% to catch an image and to bring that into, if it feels comfortable, into or around or beyond, to bring in the sensorial information into the body or into where it can meet you. So here we go. Okay, everyone can hear me still? Excellent, okay. So looking at the horizon of yourself, feeling the outer edges of your ocean body, feeling the outer edges of your peripheral body. How are your waters contained? The blessed waters that are you. Sitting with the particularities where the sunlight hits the waves of who you are. I invite you to breathe in. Breathe in as we begin to dive deeply into ourselves, just for a brief moment today. We're here together for an hour. And with the breath, notice something maybe inside that splashes, something inside that captures your attention. Just a part of you, a part of your body that wants to connect in this moment. Right? There's just a sense of just being. We don't have to go so specific. We can go with wide spectrum or microscopic, finding our place as we begin to go deep into the ocean waters of ourselves. I invite you to belly breathe all the way down past the breathing diaphragm into the belly space, diving into yourself. Maybe the breath isn't so linear. Maybe you spiral down and curl like the baby whale, going down into the peritoneal sac, where the blessed waters are nourishing and supporting and flushing the organs that are contained there. And as you breathe out, spouting out anything that doesn't serve anymore. Maybe blowing out this morning, or blowing out just the relaxation quality of this moment. Blowing out as we come to the surface of ourselves, thanking and honoring our lungs and offering them the ability to mist out what no longer serves in our lives, in our tissue. Spouting out at the surface, the rainbow mist of all the knowledge that you've carried through your generations as the alchemist of your family, coming to in this moment, where your lungs are listening. The aquarium of your bellies is listening, maybe. We create this ocean of space together, knowing that our bodies are made of fluids, mostly. We are so close to the ocean. We can splash and play, and we can renegotiate our symptoms, and we can hold space for the people that we work with by applying touch, or maybe off touch, or maybe through our words, we create a containment of exchange. Stretching into the waves of experience, breathing together now. Just a few more moments. Continuing to sense the outer peripheral body, the containment that is you in relation to your central body. It contains a visceral spine from the top of your head to your perineum, at the base of your pelvis. Your patterning and your stories all make you special and all have something to say, perhaps guiding you to lean into certain currents. Maybe as you breathe, the left lung is just asking to be held. Sensing the buoyancy within ourselves. Knowing that when we breathe in, our lungs drop and they roll like cylinders, one on top of the other. The cylinders and lobes of our lungs drop and externally rotate, expanding out in bucket handle with our ribs. Creating the song through our breath like a conductor. We sense that descension and opening and spiraling down, connecting us deep into the oceans of ourselves. Setting a deep intention of listening and experience. Our interstitial fluid is not so different from the ocean. We are buoyant within ourselves when we feel weighted. And that little place perhaps that calls you today is there to guide you, dialogue with you, rest next to you, guiding you back all the way down to the membrane of your DNA that recognizes who you really are. And as we come together in class now, we can all slowly open our eyes. Maybe we can leave an offering in the ocean of ourselves, committing that we are here to listen with great intention, to splash and play within ourselves and to spout out the wisdom of mist, the surface of ourselves every time we go down to take that deep dive into the sensorial experience of perhaps viscera and tissues, memories, that we can always come back up to the surface in our play. Taking a moment to just feel your feet on the ground, coming back to the outer shell of you, sensing yourself sitting or laying, hands on the table, going beyond into the out of ourselves space as well, recognizing that we carry an energetic field as we come together in this circle at the moment to learn a bit together today, to get to know each other and to share time. Flash. Excellent. Well, thank you for being here today. I have a quick slideshow presentation for you. I'm Carey Benenson, a traditionally trained osteopath trained in Switzerland and in Canada, based in Florence, Italy. I started my teaching career at Boston University in 2015, where I brought a course around Lyme disease and how we can support clients with autoimmune disorders, Lyme, holistic approach to care using manual therapy. I trained in what was called a 3 protocol approach, which basically acknowledges that we have a musculoskeletal system, a fluidic system, and an energetic body. And with years of experience, I've been working in clinic now for 20 years. I understood that there was a lot more in the in-between spaces, in between bodies, and in incorporating a lot of dialogue, a lot of body poetry, a lot of deep listening intent into the work, and going beyond sort of this capsule of 3 bodies, but working also in the interweaved space of working also with the story and listening to how there are no necessarily set anchored anatomical landmarks to really understand that there's an organic shape to everything. And sometimes we can even just be called by the master fascia. Going beyond the biomechanical testing, sometimes we can just listen to the connective tissue and it will draw us to the interchange spaces, like those highways where you have those big highways that all meet in a certain point. I've learned that beyond that, we have these interchange spaces where even with touch or even with words, if we connect by invite, by asking and by invite to these structures that maybe lifts us buoyant into the buoyancy of the fluidic body, or maybe even in between the fluidic body and musculoskeletal system, we can find this energetic blast that takes us into a galactic experience. There's been an evolution, which in the end has brought me back to really finding that we aren't divided between biomechanical and biodynamic. The body may ask for a fluidity of range of techniques. And so in the biodynamic osteopathic manual therapy program that's starting next year, this is an 18-month program that guides you into asking in a way where you can also honor where you come from, what you've been doing for however many years, that you can interweave the work into what you're already doing to support your clients. So we'll begin now with presentation. Let's see here. Ooh. Here we go. No, I've done this 1,000 times. Why am I not finding this? Bear with me when here we go. Thank you. Perfect. Okay, so welcome. We just experienced the horizon of ourselves, and I love the ocean reference because we can dive into the horizon lines when we're working. We can even close our eyes and ask in whatever place that we're holding to show us the horizon lines of where we can land. There's even the thought of those of you doing cranial sacral therapy where you can drop in and ask, is it the dura mater? Is it the arachnoid that may be the mist just beyond the outline of the ocean? Or is it the pia mater, which is the line where the sky meets the mountains? Playing with this imagery a lot of times can create an intent, almost an offering for the client versus getting ourselves in the way. So a lot of these reflections in nature are also how I teach palpation. When we go in deep into the deep dive of the physiology, I really like to capture these photographic moments, taking pictures with our eyes, so that sometimes we can actually, because we're holding the world now in our hands, we can actually resource the potency of nature as a fulcrum, as a temporary fulcrum and an offering within the still point. So when we think about our own waters as well, we can go all the way down. Maybe the body just invites us to go all the way down to the cellular level, getting to know the immune cells that, as you can see from this live cell morphology photograph on the left side, this is an optimal patterning of all the red blood cells sitting in the hydrating, rich, electrolyte, protein, glucose rich plasma interstitial fluid carrying these little microorgans. You have the white cells there that are there to either tag something as a foreign protein, come clean it up, or to clean through as a vacuum cleaner. There are several different types of immune cells. So our ocean waters are literally the backwater for the whale energy of the white blood cells that are there to support us. If we have something like you see on the left, which is an aggregated, all the cells are stuck together, that interchange, that exchange osmosis, allowing the portal sites of the cells, it's harder when they're sticky. And so sometimes we can see aggregation when we hold a person. We might start to feel, even through palpation, a sense of bubbling or a sense of the cells pulling into collapse. The bigger that our planet becomes with the divisions and all the things that we're living in our life, the more that the cells, the little microorgans, are calling us to come down and listen. Even beyond that, we can think about the DNA, and the membrane that protects the DNA knows who you are and knows who that patient is. So sometimes the palpation quality, again, we can be feeling a sense of sparkle or bubbles. I felt a lot of sparkling after people were getting vaccinated and sort of glittery things. But we say whatever does or doesn't serve, if this is strengthening or if this is congesting, allow that person with each breath, if it feels right, to spout out with energy and rainbow mist like the whale. We need these sorts of mirroring of nature and referencing around us to be able to really be able to nourish ourselves and show up. But remembering that the visceral work actually comes down to the red blood cell, which was our first organ, and beyond. We can catch the waters with our hands and play with those currents, where a lot of times I come from the schooling, very structural, also going into fluids and into the brain postgraduate, where the waters were such a mystery. No, first we bend forward and we check the sacroiliac joint. Does it catch when they bend forward? Maybe there's a problem on the right side. A lot of times if we go in by invite and sit with the waters, whatever your modality might be, the waters or the waters even within the connective tissue which has a grand intelligence of its own will pull you into whirlpools. Oh, wow, there's a whirlpool between the right kidney and the liver. Why is that? The glycine capsule is actually connected to our phrenic nerve, which controls the breathing diaphragm and our breathing. So why is there congestion or heat expressed through the skin? We catch the waters and we listen. And through the program, the 3 Bodies method, the biodynamic program, whatever it be that's in learning, we can see that the body carries the information. And through interrelationships and those experience of interrelationships through, wow, when I'm on the cranium, there is an interrelationship to a strain in the foot, that the navicular and the cuboid and the way that they pump as neighbors, they're the only actually 2 bones that don't actually touch but are considered a joint. That has something to do with the cranial base. We start to learn and feel into the fluidity of interrelationships in this work, so that when we go there, we can listen with wide ears and float into, wow, that makes sense. And I'm being pulled down and I'm listening beyond the waters to feel into other strains that might make sense. So the BOMT program has a lot of focus on interrelationships and less on the structure, the 3 Bodies method I've been teaching for years, but it's really evolved into multidimensional and more grand volumetric holds versus getting so much into specifics. But sometimes the body will ask us, dive in, deep dive, please, and bring these 2 neighboring structures into compression where they can have a conversation, and perhaps working even verbally in what I call brain talk and body anatomy, where we can get the brain to resource even possibly how the lymphatic system is reflected in the trees around us. The lymphatic system, the fluidic system of a tree is not very different from that of a human. And someone asked me actually today, what is it about this? Why nature? Why body anatomy? Why working with nature to teach pathology and physiology? And the answer is really clear to me. We have religious trauma. We have broken people. We have all sorts of people that can sit in a position we can go and not open ourselves even to our own family members or to our neighbors and friends. We become vulnerable as we open up. When we sit with the creator, when we sit with creation, it's a place where we can fully expand and open up without injury. A tree is not going to come into our cellular membrane and injure us. It gets the human part out of the way and allows us to really resonate and see with our eyes and sense how the nature beyond us actually mirrors us, and how we are everything and nothing and everything, like some of the quantum practitioners, Dispenza and Braden and all this quantum medicine, all these experts. But the point being is that we are a continuum of energy, and we know down to the density of our skin that we are just dense energy. So this exchange becomes also a safe way to create a temporary point of reference, a fulcrum, and be able to really let go sometimes of strains. A lot of SE practitioners, somatic experiencing, etc., the trauma practitioners, we're now interweaving because more than ever before, we need resource, even in the hands-on work. I was really inspired to dive deeper into this bio experience of mirroring in nature, which I used to call poetry and anatomy. Because in Florence, about a couple of weeks ago, we had these huge sandstorms come up in the Sahara. We had 5 days of yellow skies, eerie, gray yellow skies, and sand was just dumped upon the enchanted city of Florence. And it really inspired me how the earth is really speaking up as our bodies are really speaking up, as we have particles and proteins from what we just lived for the past 3 or 4 years, our body needs to expel, and how this struggle, even the particles of the sands of the desert, which are now dumping in Florence, and floods that are shutting cities down, and that there's a roar within us as well, which if we even look at the science of sandstorms, or if we look at proteins and particles that are expelled, antigens create a healing reaction in the body. Any sort of foreign protein in the body or antigen will stimulate an immune system response. And where we were brought from peaceful, placid, wonderful summer to a roasting oven, which we're all living, which is temperatures beyond the sky, we're realizing that this is a mirroring also of ourselves and what we've lived through. So researching a bit about sandstorms, being fascinated by it, it turns out that it's these dust storms are really important to the fertility of the earth. They actually calm tropical storms. It's all a sense of soil being re-churned, and fertility and reflection of sunlight and support. And this is, again, how we can mirror with our work, because as you know, the pain, the chronic pain, the autoimmune syndrome, it all has a message. And so our deep sense of listening is going so much more into being, even sometimes, how much more are we needing to really connect, ask, and listen to the person's story before we even work. Sometimes I might even have someone for 20 minutes before they got on the table, because they simply need to be heard. Oh. Okay. So again, we experience a bit the peripheral body versus central body. And in terms of that and how we work with the Three Bodies method, there's a lot of importance in understanding the relationship between what we call the visceral spine, which comes from the central chain, which was taught by Philippe Joel, this college at Osteopathique where I went. They were influenced from the central chain, coming from several osteopaths in the 50s. They can't quite tell who it is that invented it, but it's essentially a visceral spine. And the visceral spine is our central chain. This visceral spine is also referencing these interweave spaces. It's sometimes where people can feel when you're working on someone, there's a sense of a sleeping bag sensation where you're able to really, you're invited to hold the external, but the central is either feeling like sheared or in a twist or even out of body. The external and central body, that is becoming a great potential of the working in the in-between spaces. So a lot of times we can work with someone, perhaps they might repeat, come back in with a shorter leg, come back in with some of the symptoms that are still roaring, or even worse after a session, worse before better. Sometimes it's just a matter of holding the external peripheral body, arms and legs, in relation to the center and asking, what do you need? Sensing you're called for the two bodies to start a new dialogue. Then perhaps there's something that might float up, like the whale in that image, where it floats up. So a fluid sensation, or maybe it's a particle sensation, a structural sensation, a temperature change sensation. It will come up, and that will be a place of focus. We think about as well, the central body in reference to the peripheral body is so affected by gravity. How gravity, the lines of gravity go through the base of the head, they go through thoracic 4 in the spine, they need to land through the hips and land a specific point on the feet. Well, if they had a big accident from one side, all the lines of gravity might be something to look at and listening to. Is that person even sheared in their energetic body? So that this central chain, this visceral spine, or even just the central cylinders in relation to the peripheral body are not able to have a conversation. We have very light ways of putting on our hands and listening to where we're called, or maybe above or below the breathing diaphragm. We might have an inhibition testing where we might hold upper and lower. This one gets pulled away, and then we know the body's calling me to upper body. Perhaps we go there and the fascia takes us to the right shoulder. Perhaps at the shoulder, we then feel a sense of being pulled in to the level of the lungs, or the level of the pleura, where bacteria, metals, viruses, maybe there's a sense of irritation, agitation. it becomes a very sensorial listening. And then the structures, maybe it's saying, you know, I need a little bit more direct or something as I just need to just give this person's just asking for space. I'm going to get behind myself and I'm going to actually go galactic in my palpation, even beyond the tides, holding the chaos in between the flexion and extension, in between the tide space. A lot of times nowadays, we're holding a lot of chaos where it's even hard to hold. And this is the way that we can work through the three bodies method. So I'm talking about central body and peripheral body, and also your soul, your energetic body that was given to you with conception. That resource, was there a separation somewhere? With separation, we also know that there's a trinity aspect to all of this. There's the lymphatic system in relation to the venous system, in relation to the arterial system. That triad, that trinity is the capillary, creates the capillary. And that is the place of nurture. It is the place of exchange in the body. The input, oxygen-rich blood, the output carrying away particles that no longer serve, and the lymphatics that are carrying the immune system with magic fluids that wash in between. We are already dialoguing with something that's multidimensional. And in the three bodies method course, we just newly added. I teach now what I call the Trinity hold, where we can work a bit more dimensionally, where we're able to even hold three structures at once, all the way down possibly to the capillaries, which essentially are the little vessels that are smaller than a quarter of a piece of hair. This is where all the exchange happens. So being able to really hold all three systems is key, even at the microscopic level. That's the key to the visceral work. With long COVID, there's a distortion and there's a imbalance in the relationship between self generally. There's a lot of predispositions, a lot of frontal bone, frontal lobe of perception injuries. We look at what is called the axis of stress in Italian, the hypothalamus pituitary adrenal axis. We look at the relationship between the peripheral and central bodies. We look at the vagus nerve. And we have a lot of science, which I bring into my classes, a lot of science. We know that with long COVID, we have a different chemical makeup in the colon. They're even doing samples and seeing that with long COVID, there's a buildup of certain proteins that actually affect the production of serotonin. So there's a physiological reason for it, and it's now listed as one of the disabilities under the Disability Act. Long COVID is now being recognized, so people are able to get support and help. And I have a long COVID protocol, quote unquote, that actually evolved from my Lyme protocol, which came from my graduate studies where I studied Lyme disease for 4 years. And although osteopathy, which will call me Carey, I've gotten to this place where I want to just be known as Carey. It isn't always easy to just listen so much. So I've gone into with the three bodies method, also giving some nuggets of protocols, especially with the autoimmune category, long COVID, Lyme, SIRS, POTS, chronic fatigue, fibromyalgia. These are really, really difficult syndromes to support. Remember, disclaimer, we're not treating illness, we're supporting. Everyone already knows that this is not a medical approach. But I did study with Harvard. I actually just visited with my Swiss physician mentor in Switzerland last week. She has 6,000 patients, and she did not lose one patient during the pandemic. She did not lose one patient, and she's also a master herbalist, and I needed to sit with her because we need so much information because the pathologies and syndromes are becoming so complicated. So with that, I've also developed these sort of mini protocols where you can go to these grand central station places, go more into the focus of am I in the right place, and more expansive into what comes in, what does the tissue need, what is it asking for, going into more of the deep listening to then provide support. Okay, let's see. This is just talking essentially about how autoimmune disease is essentially, they're finding that there is a self-made antigen against self. And this again brings us back to, can we hold the level of the cells? Can we intend to listen to the level of the DNA, the membrane of the DNA, which is called the envelope? Can we go deeper into embryological, even beyond the embryological patterning? The motility of organs are set up until week 14. But there's so much epigenetic influence, and there's so much that will be carried in the field. The little embryo gyrates and builds its lymphatic system and learns in its lymphatic system before it even develops the heart to recognize what is self and non-self. Now seeing that autoimmune, the people are actually producing proteins, antigens, which are foreign proteins, against self. Where can we hold, if we hold the envelope of the DNA, who knows who we are, who knows who that patient is, perhaps the whole system, together with the central and peripheral hold, can have just 45 minutes of reset, which then can alchemize for weeks. Seeing people less is helpful, or seeing people shorter sessions, 20, 25-minute sessions more frequently. The patterns have changed. This is where I get into some of the mystics that I've studied, and I always drop into some of the mystics that I really admire and study. And I think to myself, we have a visceral spine. And beyond the visceral spine, which is actually, there's structures just like vertebra, there is a visceral spine that has structures, and it references these interchange spaces of tissue, which I also call hub spaces. And I outline that, what those spaces are in the full training. We tap into it a bit with the Three Bodies Method course. But we also know that the whole spine references a very magical ligament called the ligamentum flavum, which lives from the base of the head all the way down the spine, in between the vertebra and the posterior portion of the spine, the processes. In front, there's a lamina. It's golden. It's the only ligament that has elastin, flexibility. It's negotiable. We think about herniations. This ligamentum flavum is a source of information. And if we go by invite deeply into that in front of space, going into the in-between space, even in the spine by invite, this is excellent for people who've had epidurals, is to go with that intention, not just the core link and the duro-arachnoid, but there's also this beyond space where you get pulled in and in like so. And this is where we get really galactic. And even there, we can sit back in our chairs and imagine or call forward, thinking of the whale call, the central body and peripheral body. Just invite those two cylinders of the self to possibly reference, getting ourselves out of the way, closing our eyes and seeing, what does this body need? Is it bringing something up to the surface, an image, a sound, a song? This is the die to oneself place. So I sit with the monks almost every week, these very special monks that I know in Florence, and they basically say, die to the death of our past. Can we die to the death of our pain messengers? Can we die to the death of our past, of trauma that's encapsulated in the fascia? To then be reborn into oftentimes with this technique, there's a lengthening where the spine just grows. And the patient will come out saying, I just feel like my head is to the sky. There's a lengthening, but there's also a rebirth. And we see that babies, some of the first motions that they do is just this lengthening where the chest and heart goes up to heaven space, which is also what the heart does with inhalation, is it tilts up to the heaven. And in that moment, we are heaven on earth. So this is just sort of information to think about as we go deeper into the visceral work, where we combine the old traditional techniques. Perhaps they need a little 50-50 reciprocal tension. The body is just sort of giving this structural sense of I need a stretch, but maybe we're called into this deep listening space to the ligamentum flavum. I think you get the idea. We're making offerings even to the visceral cranium, sitting with the CEO of the brain, the thalamus, that is essentially the organizer of all, and giving offerings in our work, going beyond flexion and extension and cranial work and sinking into the visceral cranium, which is a place we really don't understand. And in fact, we only see 0.03% of the spectrum of light. Our eyes are the only part of our brain that's exposed. They also web directly into the dura mater by way of the optic nerve sheath. These are things that we work with in terms of the orbits, and maybe we're called into holding gently just beyond and calling to rise the optic nerve, because perhaps there was a head injury years ago and there was a congestion and rigidity and dehydration of the meninges of the brain. Do we need to go into all these specifics? No. But when we learn to listen to the currents, that maybe this is involving maybe the eye and the structure that expands and rolls outward with flexion and rolls inward with extension, that maybe there is where we can listen to a whirlpool that calls us into experiencing that zip code of structures, where we then follow the currents, staying 40% with ourselves, which I learned by sitting in a class with Charles Ripley. He was the one that basically said, sit 40% with yourself. Stay with yourself. This is also something that you're receiving and being given also the permission to dive in and say, there is a rock. The body is showing me that there's a rock in that spine. There's a boulder within the currents of the stream. This is more Carey talk. So maybe they need a little oscillation work. We're on their bellies. They would call it Traeger, but we call it General Osteopathic Technique, GOT, by Dr. Littlejohn, where we might just gently rock the vertebra in relation to the ribs and working on that oscillation work. Maybe there's something structural where when they get off the table, crack, they get that adjustment, because we are only 70% younger, 70%, 55%. As we get older, women are more fluidic than men, but we are so much water, we do not need force. And the bones do what they're told. We are rooted in, and we are also being asked by holding the currents to discharge the electricity out through our feet, offering a grounding, earthing experience, and being that temporary central point of reference where we can connect again to the fulcrums, temporary fulcrums. Perhaps the eagle sweeps in or the butterfly lands on the ribs. And we just sense this presence of nature that reminds us how our physiology is supposed to work as we breathe. And then joking that hypothalamus helps the hippopotamus. Sometimes a lot of students, the feedback that I get is that the recall doesn't come from here. It just comes from memory and vision, and the audiovisual learner does really well in the recall of being able to remember something very specific around how there are certain ducts at the tail of the stomach that create the whole pH balance of the entire gastrointestinal system. And they remember it because we do deep diving into the caves, into the deep diving of the ocean caves, remembering that that's how it feels when I'm at the duodenum and the bile duct is pinching down below. It is like cave diving. And we have to be careful and we have to be invited. So we'll skip over hypothalamus. This is just to remember that the three bodies method is really a protocol, quote unquote, experiential spiraling experience of listening. What do you need? Where do I go? I'm here. Which body is asking for support? Is it a structural sensation? Is it fluidic and warm and lines disappear? Is it electromagnetic, where maybe it's staticky all over and I feel like I'm just in a field of energy? Perhaps, but maybe there's both. Maybe there's chaos in between, and I can trust that the body will show me where I need to go and how I need to work. I'm going to show, just for, let's see, time's sake, I want to leave some room for questions. I am going to show the clavicle technique at the end. Let's just do it at the end so I can get through this. It's one of the most important techniques. And now, some of you that have learned with me, I saw that some of you are here, hello. In terms of supporting the soft tissue and rocking gently the soft tissue just below the collarbone, never on top. Rocking slowly moves the ocean waters, especially very helpful to the lungs that attach at the first rib, attach at thoracic 1 and cervical 7. This is a really important place as well for anyone who's dealing with self-fighting self. All of those autoimmune conditions, anyone dealing with an itis inflammation, when you look at the liver, this is an area where we can rock the left side. Number one broken bone in the body is the collarbone. Rock the left side supports about 80% of the body, mostly the lower body and the upper left side. And if we go to the right side, rock and roll, we're really supporting drainage of the cranium, the neck, and the right arm. So if we do both, gently acknowledging the spring of the soft tissue, bouncing, even if we're sitting, sometimes you're in light touch, but you're sitting and you're just in your rocking chair, that moves the lymphatic fluid. We don't want to do this if people have cancer. There are some contraindications that I would ask you to look up, but mostly an infection that's out of control. There are pathologies where you need to be careful with doing any lymphatic work. But rocking these two areas is one of the best things that we can do for any condition. It is one of the most important techniques. And now, with the new approach, this new three bodies method, we're now actually going deeper into working what we're calling, let's get to it. Here's the picture I want to show you. You will get a recording link of this so you can watch through again. This is just showing a vessel with a little capillary off to the side where you can see white blood cells rolling through the vessels to clean up. Anyway, to go back, so don't lose, here we go. So we work on the collarbone, bouncing gently, bouncing, opening up all the lymphatic fluid coming and draining underneath the collarbone into the subclavicle vein. There's also a very, very important aponeurosis, a very important piece of tissue that covers the front of the body. It's actually more in the middle. It goes through our bodies at a diagonal, basically from the liver all the way up to the back of the throat and the top of the neck. It is the front plate. It is our armor. It is a very important piece of tissue that the central body, peripheral body, visceral spine, things that you'll learn about reference this piece of tissue. And so now there are some stretching techniques that we work with after we do the lymphatic pumping. We might do some listening and then stretching between hyoid, between falx and bladder, the urachus. There's a way to work a line of fascia, a line of tissue at the front side of the body, which is like our armor, that the visceral spine refers to. So our spine does what it's told. Bones do what they're told by ligaments and connective tissue. Then you have the visceral spine that references our front plate. It will do what it is told. And this is a very influential fascia. So we're starting to look at front wings, back wings, even a trapezius, and having a melting hold at the trapezius can influence the entire spine. We're looking now more at these sheet plates. These are the areas too that get sticky with long COVID, autoimmune. These are areas that need hydration because they've been dehydrated, fermenting, acidic. And so these are the areas that we begin to work. Again, global. We work with spheres upon spheres, circles within ourselves. And it's actually quite simple. We have 6 spheres. I learned 5. They work as cogwheels. So we have these spheres in our body that work. We pressurize them each other. One will expand if the other one is tight. We work with cogwheel movement. Maybe one isn't moving, very similar to a clock. And so we work with the circles within circles, central body, peripheral body, and stacked spheres to create balance. And then the viscera might get the organs, the nerves. In this class, we learn vessels, nerves, connective tissue, organs, the soft tissue around the bones that tell the bones what to do. Soft tissue work can move bones. Of course, that's not our intent specifically, but soft tissue does move the bones. We might use some general muscle energy techniques where we might gently ask the patient to contract a shoulder to move, help the body move the deeper tissue below the ribs into the lungs attached to the inside of the ribs attached to the muscle. We can create a chain of dialogue directly, softly, by working with light muscle contractions to move the structures if the structural body is calling. Again, cylinders within cylinders within cylinders. Different asking approaches, listening to the fluidic divides in between lung lobes, listening to the fluidic divides between the peritoneal sac and the greater omentum, which is our pillow top in front. These are areas where rivers of interstitial fluid should flow. And this is what's important to us, keeping in mind interrelationships. We look at posture types. People can sit back on their kidneys. They can have a tight heart. There are all sorts of just key ways to listen. Also, when people are speaking, they might be talking. Babies do that. They're great. They just show us exactly where to work. But there are ways to also just, without being too invasive, there are ways to listen in to the posture and understand, oh, knees, we need to look at the kidneys. Knees and kidneys go together, usually always, unless there was a direct injury. So again, interrelationships are really important. This is the central chain that I learned. These are the structures of what they call the central chain, which goes way back to the 1950s. I work now with what I call visceral spine, which involves a lot of these tissue junctions, where a lot of these structures in the central chain won't change until the connective tissue has its ability to expand and rehydrate. The cogwheel spheres, there's a sixth one. We look at also the relationship between the organs and the position of the spine. Again, like I said, we do some gentle oscillating work to help open up gently and create a new dialogue between the fluids and the vertebra, with the ligamentum flavum in mind. Just a picture of some of the techniques. Again, I said vessels, nerves, and ligaments guide the bones. So we learn the aorta, we learn the femoral artery, femoral vein, and those are actually in the Three Bodies course coming up soon. Okay. As usual, I have a lot of information. We're going to move forward. I've talked a bit about the DNA, the intelligence liquid, what we call ground matter within the fascia, which guides us to the trauma points. We talked about the membrane of the DNA. It's called the envelope. It knows who you are. It filters and decides what to ignite or express. It is the alchemist protecting the nucleus of the cell. We can be called into those deep, deep levels of listening. There is a long COVID syndrome and Lyme and autoimmune protocol that I talked about. We definitely, again, working with the vagus nerve and giving gastrointestinal support, helping the neuroendocrine system recalibrate, because long COVID really is targeting the central nervous system. We talk about parent organs. Every organ has a parent organ. So sometimes if there's this whole mishmash of things going on, oh my gosh, I don't know, they've got this, they've got 20 symptoms. We go and we sit with the parent organs, where those organs evolved from. The tail of the stomach is the parent organ for the pancreas, liver. There are parent organ sites, and that goes into a lot of separation strains, separation lesions. We go into that as well. When we look at things like diverticulitis, colitis, etc., there's a real sense of separation from self. And just to end, we're holding the world in our hands. You're doing world work. We went from being a world community to then being in our homes in isolation. And now we're finding our way again back to out of divide. The divide became strong, and so did a lot of division happen. So did a lot of division happen in the body. And so we're coming back together by doing world work with our hands. If you're interested in the Three Bodies Method course, it's coming up in Silver Spring, Maryland, in September 13th to 15th. I'll be in Portland, Oregon, the 20th to the 22nd, and in New York, February 28th to March 2nd. I will also be seeing patients at the time. If you're interested in connecting with us on this course or connecting with me for any reason, you can email us at threebodiesinstitute@gmail.com. My email is osteoinflorence@gmail.com. If you have questions for me. This is the BOMT program that's starting in 2025. It is an 18-month program. It is an online, in-person hybrid program. What does that mean? In 18 months, we have 6 courses per body. So that's 6 times 3 is 18, and we do an in-person hybrid practicum for each. So every 6 modules, there's an in-person practicum. The 3 bodies in-person version, in-person course, because there's also an online course. The in-person is required in order to be able to apply to that program. It is the Biodynamic Osteopathic Manual Therapy Program. It is very biodynamic, but it also has biomechanical because they live together. Gentle biomechanical, soft tissue. And we also have, so the 18 months is the base program, and then we have branch specialty programs that are born from there, because a lot of people that are dropping into this program are also masters that have been working for many years. So there are some specialized programs as well that they can, like the pre and perinatal program that's coming. We have an LGBTQAI plus that's coming. We have some specialty programs that are really, really interesting that they can also drop into the core curriculum. For example, pre and perinatal. Some people like to drop into pelvis, lower extremity, and then jump back up into their specialty programs that are 3 course programs per subject. And it's open to all practitioners. We're definitely open to reviewing portfolios. There is certainly a caliber of experience that you need to have, but we are encouraging everybody to be heard and apply if they're interested. That begins next September. So thank you so much for